Welcome back. The Africa CDC Weekly Press Briefing on COVID-19 response in Africa is currently underway. Let's take you there live.
We began to ask about why are we not having a similar HAVAT approach to testing? Because a country like Nigeria with nearly 200 million people, more than 1 year since the pandemic began, has not conducted up to 3 million tests. And there are also concerns around the trust, how people can trust the results that are coming from these tests. Let me give you two quick backgrounds. There was a news in Nigeria that when some Nigerians traveled to Ghana with a negative COVID test, on arrival, they will say that they tested positive, so they have to be paying $100 per night during quarantine. And these are really eroded trust that maybe the results are not reliable. So personally, in Nigeria too, I decided to explore this further. So I did 2 sets of COVID tests in 2 different laboratories. The first lab said I tested positive, and the next day I went to another lab, and that result said I tested negative. And currently I'm in the UK, where on arrival my day 2 test results showed I'm negative. So we can, so there are these concerns around trust of the COVID test seems to be quite valid. And so I would like to know what is being done to improve trust system in the COVID testing. And taking the question on testing further, what is currently the level of trust such that in addition to bringing down the cost, antigen-based tests are being used so that the cost is brought down and it becomes available? A second question I have is on the recently released results of Ebola vaccine study in Syria alone that shows that is well tolerated and safe for users as young as 1 year. So I would like to know your remark on the outcome of these studies. Thank you very much.
So thank you, Paul. First of all, let me start with you actually asked about 3 or 4 questions in your 2 questions. I mean, let me start with the expanded testing in Nigeria. It's not only Nigeria alone. You've heard me on this platform over and over asking for testing, that if you do not test, you do not find. And the only way that you win an infectious disease, your fight against an infectious disease is to test. Okay, you test and you find out, you know what it is that you are dealing with there. And that is why, as I said earlier, in response to one of the colleagues on this platform said, we will be launching a vast campaign of testing, rolling out testing. Access to tests is not longer an issue now on the continent. It was an issue 1 year ago. It is not an issue anymore because there are so many products out there, good quality products for tests to conduct PCR testing. Just 4 weeks ago, we were in Morocco, and there's a company there that is producing quality, top-notch PCR tests, which will be encouraging African countries to buy a lot. I think the test costs about $5 or so, or less than $10, just to be not to be very, very specific there. So we encourage all countries to ramp up the testing, but to expand the testing and not just limit it to people that are traveling, and to use it more to find cases, what we call surveillance, so that you can actually detect people that are infected and don't even know their status, and then let them take personal responsibilities. That's the only way we are going to bring back this, beat back this pandemic. Because as we've discussed, vaccination rate is very low. We are at 3.5% with respect to those who are fully vaccinated. So it means that our public health measures, which is underpinned by large-scale testing, must still be encouraged. With respect to the validity or trust of tests, as a virologist myself, we lay a lot of emphasis on quality assurance. That's why we've worked very hard with the African Society for Laboratory Medicine, commonly called ASLM, to expand quality assurance programs and to train, and continue to train on quality assurance programs across the continent. So again, we have to make sure that the labs that are authorized to test do implement quality assurance, and it's only authorized laboratories that are conducting the test. Just excuse me. We believe that except we all collectively work together. That is, countries only allow specific tests, specific laboratories that are fully certified to be to conduct the tests. That those laboratories conducting tests enroll in continuous quality improvement processes, and that there are checks and rechecks. We will continue to have issues. It's not only for COVID testing. Anything that you do in the laboratory requires aggressive quality control measures. So I think there's need to continue to enhance that, admit that there's some limitations when you do testing. It's not just for COVID testing. We're testing across the board. We've lived with HIV for 40 years, and we still continue to enhance quality assurance programs for those so that we ensure reliable test results. With the Ebola vaccine, I don't think I fully understood it. Was it that the vaccine is effective in younger age population, or can you just ask that question again, Paul?
Yes, the results show that users as young as 1 year can take the vaccine and it's safe and effective. So I want to know what you believe the outcome of these findings mean for Ebola response in Africa.
No, that would be huge. If clinical trials have been shown to demonstrate and back that children that are that young should receive the vaccine, that would be wonderful news. I think the most important thing is that we should back up our programmatic decisions based on evidence and science. So if those studies have been conducted in children, there is absolutely no reason. There is really no reason to believe that that should be the case and should actually become policy. The issue with the children and Ebola is that, of course, they are infected. So if they are infected and they are vaccines that can be administered at that age group, then it means that we have actually expanded our toolkits to fight an eventual Ebola outbreak, especially using ring vaccination if these vaccines are available. So you'll not be restricting it only to adults, but to children. So that would be very encouraging results.
All right. Thank you very much. Let's go back online and welcome Sophie Mukwena, who is with SABC. Good morning, Sophie. Please go ahead.
Thank you so much. Dr. Nkenkesong, when you were addressing the media briefing on Tuesday with the WHO director and Mr. Masiwa, one issue that I picked up was that it looks like our strategy as a continent in terms of access to vaccines has been pushing very hard at international level, different international platforms, to push for TRIPS waiver, which is actually a long-term goal, or one can say that's the aim. But in terms of objective, what we can achieve now to speed up access to vaccines, it looks like we were off the mark. I mean, the president of France also indicated that yes, TRIPS, but come up with a clear program for now, what you want and how to achieve that in terms of access to vaccines. The same with President of the United States of America, Joe Biden, at the G7. Now you have Biden, who has organized a sideline meeting on COVID-19 or conference or summit ahead of the United Nations General Assembly. And you also have the G20 meeting coming. Our President Ramaphosa, is leading the campaign on the continent to fight COVID-19 access to vaccines. He is also a co-chair of COVAX. He is a member of, South Africa is the member of the G20. We are also part of the UN. We might be participating at the summit with Joe Biden. What is your advice? Don't you think it's time for us as a continent, leading the charge, the president of South Africa, Cyril Ramaphosa, to change the gear and come up with something that can be immediate? The objective, the long term of TRIPS waiver is fine, but let's push the objective now, what we can do. And clearly the objective will be to push that pharmaceutical companies must release stock, because Strife Masiwa is saying we have money, but we can't buy because they are not making vaccines available to us. When we see big nations producing these vaccines, why are we not changing the strategy? Come up with the objective. We'll deal with the aim later.
So I think, Sophie, you touched on very key issues on which, trust me and believe me, we are dealing with all of those issues simultaneously. We are not dealing with the other issue separately from access to vaccines now for the continent. I must say that, and I'll say this very clearly, that we need transparency in who is producing vaccines and where are the vaccines going to, because you hear all kinds of versions that the vaccines are not available, but yet countries are vaccinating. Okay, I mean, developed countries are vaccinating and achieving high percentage coverage there. So we don't know where these vaccines are coming from. And we have money on the continent. We don't have access to the vaccine. So it's really not a money issue. You've heard from Mr. Masiwa said many times that this sharing is not our solution. Tell us where the vaccines are. We'll go buy vaccines for our people on the continent. And I think that message has been very consistent. I mean, we welcome all donations, but that is not going to provide us the long-term solution to solving our problem. The president of South Africa, President Cyril Ramaphosa, has been an extraordinary, exceptional hands-on leader in this crisis in two ways. This is absolutely a technical and public health position that I'm laying out for you with clarity. One, it is through his push that we were able to at least begin to achieve waivers. The United States came up, President Biden, remember a few months ago, saying the United States agreed to that. So it was because South Africa had taken a position, and the African Union endorsed that position and moved that forward during the February summit. I think we have a record for that. It is because of his championship that we got there. Second, the 400 million doses of vaccines that we signed with Johnson & Johnson that have started being distributed from the Aspen facility in South Africa is actually thanks to his personal hands-on engagement in the process. It's a long story, but he and Mr. Masiwa have actually been my true heroes in this battle against a COVID vaccine access on the continent. I usually, in a light manner, characterize them like the COVID warriors, the COVID vaccine warriors for the continent. They are truly our COVID vaccine warriors because they have been personally engaging with Johnson & Johnson and the Aspen Pharmaceutical Group in South Africa to make sure that we have these vaccines delivered in Africa. And we've been talking to all vaccine manufacturers, all of them in Africa, including anyone who wants to sit down and talk to us. We have been talking to them. So it's not like we're waiting for the waivers to come in, which will take time, as you say, and then we wait for these vaccines to come. We are hands-on. We are actually working with everyone who wishes to work with us.
Thank you very much for that. Let's go to a question that's coming in from Adis Getachew. And Adis is the correspondent for Anadolu News Agency. So he says, could you please tell us what the challenges of having to use different vaccines in Africa have been in terms of tracking how many people took which brand? And then he also asks about the challenges, the logistical challenges, as different vaccines may require different ways of transporting, storing, etc. So those are two questions from Adis.
So there are only two vaccines that truly required an ultra-cold chain. That's an ultra-cold chain, just meaning that you need a minus 70 or 80 degree freezer to store them and then transport them to where they are needed. That is the Pfizer vaccine and Moderna vaccine. We know that for the rest of the vaccines have all been produced in a way that you can move them with the traditional cold chain, which is the 2 degrees to the 8 degrees refrigerator. So I think that is an issue that if I would say, and I've said before, that that shouldn't be an issue. If you gave me the Pfizer vaccines, in Africa, I administer them in major cities. I would not move them into remote areas. So you make it a major city vaccine and roll it out in major cities. Major cities have power. They have deep freezers, and you can actually expand that very easily and monitor it and track it. Set up a system that you can track all of them so that they ensure that they are functioning well. So that is, in my view, not a problem. The challenge you have is predictable access to vaccines. And that leads me to your first question you asked is, all these vaccines coming in there. We cannot stop countries from accepting vaccines. We cannot stop donors from donating vaccines, but they come in all kinds of forms. The AstraZeneca comes, the vaccines come in, the Sinopharm come in, the Sinovac comes in. So it's all mixture of vaccine. All what we are asking, and this is what I said earlier, and we also discussed that in Geneva, is let us have at least a way to manage the collection of vaccines, the donation of vaccines, so that we can plan and support countries accordingly to deliver the vaccines and document who is receiving which vaccines and when are they receiving it.
All right, thank you. Let's move to our WhatsApp platform and say good morning to Sarah Jerving, who is with Devex. And Sarah says, on Tuesday, Benedict Orama said that $300 million is urgently needed with the target raised to 70%. And I think there she's talking about our initial prediction of needing 60% to achieve herd immunity. Then she goes on to say, will this 300 million be spent upfront as upfront financing for the purchase of vaccines? And if so, which manufacturer is the African Union in discussion with?
So I think President Orama, the president of the African Export-Import Bank, was right. I think that is, as we shift our targets, I mean, the bankers have made their calculations and they said they will need in addition an additional $300 million, and it could be applied towards any vaccine. It doesn't need to be the Johnson & Johnson or any other vaccine. We are looking for vaccines, effective vaccines that have been proven to be effective, and vaccines that are safe. All vaccines will be looked into. For now, do we have any company that is close to signing agreements with Harvard? No, we don't. Because again, as I said earlier, manufacturers are not, we don't yet have anyone who has come up and said, look, here we have enough vaccines and we can sign a contract with. Would the money be required upfront? The Afri-Exim Bank is ready to support those facilities. Remember, the Afri-Exim Bank committed $2 billion earlier on, and it is thanks to that commitment and that they were able to pay the Johnson & Johnson and countries bought into that contract. So I believe that if there's enough clarity of the course of action, the Afri-Exim Bank will be, and others will be ready to put on the table financing to support those additional doses that will be required to get us to 70%.
All right, we come back to Judith Akolo, who is with Kenya Broadcasting Corporation, and she says, my question is, we have noticed a slight drop in the number of new cases of COVID-19 with the positivity rate at 7% yesterday. And I think this is in reference to Kenya. Then she asks, can we comfortably say that the fourth wave in Kenya has plateaued and is now coming down?
I've not seen the specific data from Kenya, but if it is beginning to come down slightly, we hope that we'll see in the next 1 week or 2 weeks if that trend continues. And then we can rightly admit that we are beginning to bend the curve and plateau it for the fourth wave. But if you look at so that is the short answer to that question. But let's not fool ourselves with this, the peak and the troughs here. The truth is, if you look at the pandemic, the period between the first wave, the second, the third wave, and the fourth wave, it is usually an interval of 2 months to 3 months. So you come down to the trough, you can maintain it there for about 2 months or 3 months, and you go back upwards. So I think what we should be doing now is clearly working with member states to say, when we go down, the peak, what do we really do? What are the measures that we should put in place so that we do not go back up there? Because if we keep doing the up and down movement, the impact on human lives is tremendous. I've given you some evidence. 72,000 Africans died during the third wave. So that we do not repeat that for the fourth wave and the fifth wave. It has tremendous impact on the economic toll that by these lockdowns. I think this the United Nations Economic Commission for Africa, UNICA, has in fact produced some figures which I'll find and share with you or next week, which speaks to how much damage it does to the economy by the lockdown. So we really have to be balancing between saving lives and saving economies, so that when we come down, when Kenya comes down to the trough, what do we do to keep Kenya at that level?
Thank you very much, Dr. John. We don't seem to have any more questions coming through. So perhaps let me then give you this time to summarize your key headline points for takeaways from today's briefing.
So again, my key points is really that as we gather next week at the United Nations General Assembly.
Hello, Dr. John.
Yes, can you hear me? Hello? Hello?
Hello, yes. I was saying that we don't have any more questions, so this would be the time for you to give us your summary of the main headline points.
So if you can hear me now, I was saying that it's just one point, that as we gather next week at the UN General Assembly, it is my hope and wish that access to vaccines on the continent should take central stage, because we cannot live in a world of vaccinated and the unvaccinated. That is not the formula to win a pandemic. We have seen what has transpired in Israel. We've seen what is going on in the United States, where a large chunk of the population is vaccinated and a large chunk is not vaccinated. But you see the impact that it begins to neutralize even the effect of the vaccination, what the vaccination had done in terms of protecting people from severe illnesses or severe deaths. So I think that will be the same thing. If the developed world is vaccinated and Africa is not vaccinated, you see the same effect happening there. So I think it is my appeal that discussion, a specific discussion of how do we quickly make access to COVID vaccines on the continent of Africa should be the central point of discussion for next week's UN General Assembly meeting.
All right. Thank you very much for that. I will have to apologize to you because we have one question that's just come in, which I think we can take in the remaining few minutes before we run out of time. And it is coming from Mario Baptista. And he says, you said that Equatorial Guinea has been added to the countries facing the third wave. However, Equatorial Guinea's figures of 10 seems rather small. How do you explain this, given that there have been several organizations questioning the country's data?
So remember, this is the country's reported data, and it's not about the number of cases. It's you're comparing your 7 days moving average each time with the previous week. Okay, you are not. So we do not go to any country to gather data from that country. We work on data that is reported from the country. That is what everybody, all public health organizations do. So even if your numbers are low, we're comparing the numbers of the previous week and the numbers of this week, okay, to determine whether you are moving towards the third wave or the fourth wave.
All right, thank you very much. And that was our very last question for today. So let me thank Dr. John. He's already given us his summary. Let me thank you, colleagues joining us from throughout the world. And also thank you to the team behind the scenes at the African Union and the Africa CDC. Let us meet again for another press briefing next week on Thursday at the same time. Bye-bye for now.
Now, the director of the Africa Centers for Disease Control, Dr. John Nkengasong, leading the weekly briefing of the Africa CDC Weekly Briefing response on COVID-19. Let's now